and welcome to Health Live at Seniors Today. We are on our 4th edition and we have an interesting theme for our discussion, stomach. And to address these questions that you may have and to speak to us is Dr. Prasanna Shah, a leading gastroenterologist. So we have Dr. Shah here with us, and he's going to talk to us about matters relating to the stomach. Dr. Shah, over to you.
Thank you, Pradyuman. Thank you so much for those kind words. And I thank Senior today for giving me this opportunity to share and talk in times of this angst and anxiety amongst a lot of people. As you said rightfully, that stomach is a very important organ. A way to a man's life is through the stomach, as they say. To his heart is through the stomach. But we, as doctors, obviously take the heart first and then the stomach. So the stomach, let me tell you, when we talk about stomach and people, generally put their hand around the abdomen. Now that's called the abdomen. And the stomach is an organ which is placed, right in the left and the middle part, in the upper part of the body, just below the lungs. Now that's just one small organ, and that's called the stomach, which produces certain acids, and the food gets basically minced there and gets into puree form, and then further goes down into the intestines and gets absorbed, and in the colon it gets excreted. So that's, in short, very short, how our digestion goes. So stomach is an organ which has acid, and therefore people have a lot of acid related issues, and a very common term people call is acidity. Acidity means terms of acid. Now acidity can present in many ways, but the typical way it presents is burning. Burning behind the breastbone, behind the chest bone, as we say it, and the burning can go all the way up to the throat. So that is when you're actually, having acid coming up, and that's called acidity, a reflux. And when there is burning in the center of your stomach, just at the epigastric region, below the breastbone, that part is also called as burning in the stomach, and that is also called as acidity. It has many forms and many things. The other thing which I want to also, cover in this discussion is constipation and obesity. I feel that these three things are very important. It's not that only the young are obese, we have even elderly who are obese. Obesity is a big issue. I could really say it is a pandemic, and it's a silent pandemic which people really don't know. We are slowly becoming the most obese nation of the world. America is number 1. We already are leaders in hypertension and diabetes, and these are all contributory factors to obesity and vice versa. So that's one thing which I would also like to touch upon. And the third one is constipation. A lot of people have these things about bowel movements. We are probably a bowel obsessed nation, as most of the nations, I'd say. Till we don't evacuate ourselves well, I don't think we have a good day. And the commonest thing we hear in our practice is, doc, I'm not feeling fresh. This freshness has to be, that you've pooped well. That is the freshness they refer to, basically. So that is another thing. And there are a lot of misconceptions about the term constipation, because people come to our OPD and they say we are constipated and they're passing 3 motions a day. Well, that's not constipation. Constipation by definition is, one bowel movement or 1 to 2 bowel movements every 2 to 3 days is called constipation. You pass once or twice a day, it is normal, it is okay. It doesn't mean anything. More than 5 stools per day, we term it as loose motions. Otherwise, the rest is normal bowel movement. Most important in your bowel movements is you should know whether you're having a spontaneous bowel movement or is it a forced bowel movement. Those are the 2 important things. So I'm saying that once if people have their medical terminologies well understood, it becomes very easy when they come to a doctor. Then that becomes much better for us to understand the problem, because a lot of people have these misconceptions of gas, bloating, tightness, burning, acidity. There are various terminologies for this which people use. So I think a basic medical knowledge amongst everybody is good. And I think at this time it is important because we all are in lockdown. There's a lot of time. A lot of people can just read through few of the basic medical terminologies, and that should really help us.
Doc, you mentioned about reading, and we all know about Dr. Google, right? Where everybody refers to Google now.
Yes.
Is that a dangerous thing? Is that fame? At the age of a little learning is a dangerous thing. Are people reading too much and self-medicating and perhaps over-diagnosing ailments which they may not really have?
Yeah, sadly, what is happening is, Google gives too much information and you have to read between the lines. And the reading between the lines is the job of the doctor. You can read the Google, it gives you a good perspective of what the disease is, but don't diagnose yourself. You really need an expert. So I think it's important that, okay, people can read Google and they can see what their symptoms are, and accordingly they can, guide themselves and go to a proper, and then go for proper help once they know their basic. So, there are two ways to look at it. Either you can become a Google doctor and treat yourself and then land up giving yourself a diagnosis as cancer, which is a very common thing. Everybody thinks they have developed cancer, which is not so. Or, they just don't read and they come and then they take proper advice. So that's my take.
From your experience, have you started getting more people complaining or coming to you with problems thanks to reading of the internet? Has that increased in the recent past?
Absolutely. There has been an increasing trend. So now people just come to us and say, Doc, I have irritable bowel syndrome. So they've come with a diagnosis, and now we have to really unwind that and then dissect it and then go into the problem. So it is difficult. But I still feel, and I would still maintain that it's okay if they read, the Google. It's all right to give a good guidance to patients, but don't diagnose yourself with that, because things can go horribly wrong. So it's a word of caution.
We have so many questions that have come to us over here. Our first question is from Govind Sidwani, who says, I would like to know about the reasons for a 24/7 bloated stomach.
So the commonest cause of bloating in the stomach, which people might feel very, very surprised, is we swallow a lot of air. So that is one of the commonest things. Swallowing a lot of air, what we call aerophagia. People keep swallowing air if they eat fast or they're drinking water very fast. So eat slowly, drink water slowly. That's very common. Second, the most common is small intestinal bacterial overgrowth, what we call as SIBO. There's bad bacteria which produces gas, and then that can cause a problem. So these are the two commonest causes of bloating.
Our next question is from Sanjay Malkar. He's an architect. He was diagnosed with mild reflux esophagitis in Jan 2019. Since then, he has taken some medicines, Happy 20 and Gastractive on SOS basis, also syrup, reflux as prescribed by a leading doctor. But I feel the sensation when I drink any hot drink. Also feel similar sensation while drinking room temperature water on early mornings. Sensation is felt on lower part of esophagus and inside stomach at left part. Medicines help relieve pain temporarily but doesn't cure it. Please guide for food and other medicinal cure.
Yeah, so he typically is giving us symptoms of basically reflux, and he's said that he's got reflux esophagitis. The medicines which are prescribed are very good. All right, Happy is a brand of a certain antacid, which is a good drug. The important thing I would say is that people who experience reflux or burning in the chest, what are the things they should avoid? That is very important. So one has to avoid fried foods and chilies. One has to avoid coffee, garlic, onion, mint. These are common refluxes. All right. Now, alcohol also is not good for reflux. Smoking also is not good for reflux. So typically when I say all these things, so patients always say, okay, doc, you're telling us get rid of all the evils and become a sadhu Maharaj and just lead a very simple life. I said, for a moment you can do that for a short period, say 6 to 8 weeks. After that, slowly start introducing, things back into your life. But important, very important, what are the known refluxes are mint, chocolate, onion, garlic, Cheese also, so these are important. Other thing, he has to have small meals. When you have large voluminous meals, you can reflux. So you need to have small meals and frequent meals. That is very, very important. The
Uh,
other thing also is avoid beverages. You should avoid beverages because what can happen with beverages and sodas, there are again refluxes. So you should avoid that. Eat early, sleep early. That's the mantra.
you have a lot of people who pop in the antacids like your Gelusil or Digene or Tums, with various brand names that I'm reeling out. Now, is it healthy to just have this because you feel like uh, a little stuffed on after a meal?
Yeah. So the antacids are available OTC. They're called over the counter.
Also,
People start popping them, left, right, and center. Too much of something is not good. Too less of something also is not good. So they have to actually just strike a balance. And invariably, most of the patients who come to me are basically who have already taken antacids and they're antacid failure. So obviously, the problem is a little more serious, and therefore they need medical help. But to avert a situation at that moment, I think antacids taking is all right. There is not an issue.
I also find an increase in consumption of products like Yakult or other probiotic curd, etc. Is that something that is healthy to take?
See, this is where we are going into what I called as a small intestinal bacterial overgrowth, SIBO. That means we have bad bacteria in our gut which starts producing gas. And how do you decrease this? Is by replacing it by good bacteria. Now there are probiotics and there are prebiotics and probiotics. Now there are both these groups which are available, and there are a lot of capsules and a lot of medicines which are available. But the best natural probiotic is our desi dahi, curds. It is the best thing. It's the best form one can have, and therefore chash also is very good. It gives you a good dose of probiotics, and that will reduce your bloating and all these things. And it basically makes your colon healthy. When your colon is healthy, it's producing less gas, forming good stools, and you get good bowel movements. So that is very important.
We have a question from Bhavesh Kanakia, who says, I don't feel hungry every day. It's after 6 to 7 days that I feel very, very hungry. Few months back, I was not at all feeling hungry, but I used to eat. I have lost nearly 10 kilos of weight.
So obviously, so we have to take this scenario as a weight loss. So the whole perspective becomes different when you're talking about weight loss. So he needs to be investigated. Obviously, he needs to be investigated. Why he's not feeling like eating? There can be many reasons. There can be thyroid reasons. There can be multivitamin deficiencies. I don't know what is his age. Commonly, we would think of some malignancy in the body, which is producing this kind of loss of appetite. So he needs to be, definitely investigated, seen by a physician, and then, taken it forward. That's my advice to him.
We have a question from Usha Itraj, who says, I don't know whether it's a condition for her or somebody else, but continuous burps at night. Is there a cause for that?
See, continuous burps, what happens with, basically they're called eructations. There's basically which gas which is trapped, it comes up and it produces sound because it goes, just below our vocal cords. So the vocal cords vibrate and therefore you get that noise. That's the burp. Sometimes it can be just a reflex, sometimes it is conditioned, and then sometimes it becomes, involuntary. Initially, to begin with, it's voluntary. Anything which is emitting from ourselves, it just gives a sense of good feeling, and therefore it becomes more of a habit. Sometimes stress, strain, sometimes too much of this can also manifest as just burps. Some person who requires attention might just do this. So, we have to think in both the terms. Either they're having some acidity or some gastric issues, or they're having some stress or some psychological impact. And so therefore that needs to be looked at.
We have a question from Mr. Devakar, who says, hello, doctor. I have had angioplasty in 2011 post a heart attack. My heart is functioning at 35% now. Doctors have advised an intake of 1.25 liters of water per day, including food consumption, resulting that I have issues with constipation and it's pains when I use the toilet. I was prescribed Movicol sachet, which did not give me much relief. Later, I was prescribed Lactitol, which was also not effective. Since the last 15 days, I have started Triphala Churna, which gave me a bit of relief. Still, stomach feels heavy all the time. I have diabetes, which is very well controlled, and I feel I follow the proper medication schedule suggested by doctors. Any suggestions?
So, Divakar, I hope you're feeling better and I hope you're recovering well. Sorry to hear that. Diabetes is one of the very big common causes of slowing of the intestines. And so therefore, the movement of stool can also get hampered because if your diabetes is not under control. Also, if it's under control, people can still have, evacuation issues. The medicines which you're taking, Movicol they're good granules. Lactitol also is good. I'm sorry, but I really don't know about Triphala because that's not real my medicine or my science. That comes under a complete different science. I would suggest that you change your laxative to something else. Your heart, if it's functioning properly, then that's great. But if it is not functioning too well, obviously we need to hike up your, laxatives so that you have a good movement. Because any stress or strain you do while passing motions is going to impact your heart, and that's going to worsen your condition. So I would just think of putting you on some higher laxatives that should solve your problem, and give you something which will move your colon, because your colon is generally it's started to become a little lazy, as what I would think. So something to move your colon and something to give you as a good laxative dose.
We have a question from Shabir Kachwala. He says, my son, who's 17 years old, is diagnosed with Crohn's disease. He has been recommended Budes CR, Mecosol OD, Folic, and VSL #3. He's taking this medicine regularly, but he's still having regular stomach pain.
Yeah, now Crohn's disease or an inflammatory bowel disease, it's unfortunate. I'm sorry to hear that he has this disease. This is basically called as an inflammatory bowel disease. And there are two components to that. One is a Crohn's disease and an ulcerative colitis. Now, Crohn's disease, it basically causes inflammation in the small and the large intestine, where there can be ulcerations, there can be strictures, and there can be fistulas. So that is what we call of Crohn's. Now, why do they develop this? There is a hypothesis. There's some infection which has caused ulceration, and that has caused this problem. The medication which you are taking is absolutely fine. Budes CR is basically budesonide. It's a steroid. It will reduce the inflammation. And I'm sure you're taking 5-ASA, or that is Pentasa or Roasa, what is available in the market. You're taking an adequate dose of that. Please understand, this disease is a waxing and waning disease. Some days will be great, some days will be bad. I think you just have to wait it out, and it's a patient's job. The thing which I advise my patients is, you take milk products, but avoid having milk in that. So that is one thing which I would just recommend, that have milk products like curds, cheese, butter, everything is allowed, but don't have milkshakes or ice creams and kulfis. Just avoid that, and he should be fine. I think don't stress about it. Another thing which worsens inflammatory bowel disease is that if stress makes it worse. So just ask him to be calm. I don't think he should have any more problems.
Is that food allergy test a recommended thing for most people, who are unsure about some kind of ailment, which has no real source or no real manifestation?
Yeah, so you know what? After we do extensive investigations, when we really can't find anything, then we have to look at a food as an allergen causing a problem. And once you eliminate the food and the allergens, then definitely they find a good relief. Like the commonest and the classic example is celiac. So you take off, you give them a gluten-free diet, and they do wonderfully well. So same way, some people could be allergic. We've seen a lot of people allergic to dry fruits, nuts, then milk, garlic, fish, and seafood. People are hypoallergenic to seafood. So you take these off the diet, and definitely they start feeling better.
We have a question from Anita Narang, who says, I and my family members are having mild to severe constipation. Some of my family members are having mild to severe constipation. What cure would you advise, and how much daily water intake should be there?
So we generally recommend 6 to 7 glasses of water, but the elderly people usually they have restricted fluid intake because they have cardiac problems or other problems. Get a good fiber diet, have plenty of fruits and juices. Okay, that is very important. And depending on how bad your constipation, one would give you, some mild laxatives or agents which would move your colon, and laxatives or anti-anxiety medications also. Another thing for constipation is you have to see how much stress you have, and the other thing one has to see is some medications, because sometimes medications, opioids and all, can cause constipation. So you have to be careful of what medicines you are also taking.
Uh, Ashok Tulshan says, and is related to your earlier response, is depression anyway related to stomach problems?
Absolutely. There's something called as a brain-gut axis. So what the brain tries and gives us signals, that's how the stomach responds. Either it responds with pain, it can respond with, loose motions or constipation, and that's how the whole concept of IBS has come in. It's called a brain-gut axis. So there's definitely a response. I mean, there is definitely a connection to what the brain sends signals to the stomach.
You spoke about food intake, and we have a question, two-part question from Milan Mehta, who says, is it true that breads, pastas, pizzas combined with sodas late evening causes constipation? And the next question that Milan Mehta has is, why wheat fermented food like cakes and pastries and tubers cause bulging stomach?
So both these things are very simple. You're intolerant to those foods. So the commonest thing is when people talk about this, you start eliminating certain foods from your diet, and you'll realize that, oh, when I eliminate, say, pasta or maida from my diet, I became better. Similarly, if I avoid bread, I'm becoming better, because the yeast, they might be allergic to the yeast, which is causing the problem. So these are all foods which one has to eliminate and see. Over a period of time, you will get your answer. That's my only advice I can give them, honestly. Regarding constipation, as I said, you just increase your water intake, have adequate fiber, take adequate rest. That is another thing which is very important.
So tell me, what is the kind of food that you would recommend, a typical diet that you would recommend uh, to somebody who wants to just stay healthy, may not necessarily have some ailment, but typically, and we have a diet column in our magazine, but still something from your perspective that you would recommend?
Good diet is a diet with good amount of proteins, mild to moderate amount of carbohydrates, plenty of liquids. This is very important. Your proteins have to be good. So usually 40 to 60 grams of protein one should have in a day. Carbs, people can be carb intolerant. People get a lot of gas with using, with carbs, like after having rice and starch, like potato, they can have a lot of gas. So you avoid rice and potatoes, immediately the bloating goes down. So that is important. So have a good protein diet. Okay, have some fiber in your diet. Have a minute of carbs, because carbs gives you energy. So this would be like a well balanced diet. Important is uh, what you eat and not what's eating you. Please understand that. Okay, if you understand this concept, you will have a fairly good gut, because it's always the stress and all that what eats you gets you basically knocked down.
You have a lot of people who are, because of this lockdown period and work from home, you have all types of erratic eating habits, and you late nights, you binge watch. Students are there at home. This is an extended vacation, so they are up till 3 or 4 in the morning, and they have this late night snack. So what would you recommend in case you're watching a movie, you're up till late in the night? What kind of food would you recommend, if at all, beyond the 2-minute noodles?
That's a tough question to actually answer. I would say, people have burgers and pizzas in the night, and they're absolutely fine. They don't have any problems. Rather than talking about food, let me tell you what can happen when you have these food eating habits which are so erratic. One is you can get a lot of reflux, you can get a lot of acidity. All right, that's one. Two, it can lead to an overburden in your intestines, leading to indigestion and other problems leading to that. Three is you can develop, because your circadian rhythm has shifted, your sleep patterns have shifted. It can lead to a lot of irritability. It can lead to less of concentration during work. It can lead to constipation. It can lead to an irritable gut. So these are important things one has to look out for. The other very important thing which I would stress is obesity. You have to be very careful, because in this lockdown period, you know, I've been doing obesity work for the last now almost 10 years. And we've treated obesity by endoscopy and by diet and exercise. These are the two main forms. So I foresee a lot of obese people after the lockdown is going to get over and going to come for help. Like, we require help to bring our weight down. It's not only just surgery. This platform I would like to share and tell people, when we deal with bariatric surgery, there are bariatric endoscopic procedures also which are available. We have the gastric balloon, we have the sleeve gastroplasty. These are two very important things which can reduce weight of people. I mean, I've been doing the gastric balloons for almost 10 years. I've put more than 300 gastric balloons, and patients have lost good amount of weight, 15 to 20 kilos in 6 months or over a year. And that is all. It's a program. It's a program where they are monitored, where the diet and exercise is given to them, and they have to come back to us every month, telling their progress. Similarly, sleeve gastroplasty is a procedure now, everything endoscopically. There's no surgery, no incision. You take the stomach and you suture the stomach from inside and make it into a small pouch, and therefore you lose weight. And you have a continuous weight loss for up to 3 years. That's plus you have to diet and exercise. There's no shortcut. There is no shortcut in medicine. You have to go through the rigmarole of aid your weight loss by doing these endoscopic procedures. Plus, you have to diet and exercise. People tell us, but doctor, if you're going to tell us to diet and exercise, then why do we need to do all these procedures? We'll just do diet and exercise. That should be fine. I said, go ahead and do it. No problem. And mind you, a lot of these people can diet and exercise for 1 month, 2 months, 3 months, then they break down. And once they start eating, then they go back into the cycle. This is the waxing, waning cycle of obesity. So therefore, it is important that you recognize in this lockdown, eat right, but eat in small portions and exercise. Try to get in as many steps as possible, between 5 to 10,000 steps. I'm speaking to an elderly crowd, who are, I'm sure, very young at heart. So I would definitely say 3 to 5,000 steps is very good for them. If they can extend it to 8,000, that's great. And 10,000, they are absolute winners.
Thanks. Dilip Dalal says, my wife is diabetic. She has stomachache practically every day. She goes for motion 5 times or so, and at times no motion. Please advise.
So we have to rule out whether there is any infection basically in the stomach. Plus, some medicines which you give for diabetes, the anti-diabetic medicines, they per se can cause some bit of a loose motions. So he has to review the medicines with his doctor. And I'm hopeful that things will get sorted out with him.
We have a question from Virendra Momaya, who's age 58. I'm having abdomen pain in my left bottom since 1 month, 2 days back. I had undergone sonography and diagnosed as small diverticuli, noted in sigmoid colonic wall, gaseous distension noted of the large bowel.
Basically, he has what you call as a diverticular disease. Now, what is this? They are basically small pouches which are formed in the colonic wall. There are defects in the colonic wall, okay, which develop over a period of time if there is a lack of fiber. And that's where these pouches can develop. Now, these diverticuli can be 1, they can be 2, they can be many, they can be small size, medium, and large. And so we've seen them all. So these diverticuli, what happens is the stool gets stuck in the diverticuli, causes an inflammation, and that inflammation in the colon can produce pain. then the infection can get into it and they can become infected. These diverticuli can perforate, so it can cause perforation, it can cause bleeding, it can cause severe pain. That is an absolute surgical emergency. To avoid diverticulitis, one is have good bowel movements, have not too much of fiber, but have very minimal fiber, but good adequate liquid intake. If he develops a fever with a pain, he should go and get immediate medical attention.
Ashok Swami says, is asking you, please tell us how to cure SIBO and the diagnosis for it.
See, the diagnosis of SIBO is a breath test, which you do is a hydrogen breath test. And to cure it, rifaximin is a very useful drug for it. So he needs to take a course of rifaximin. And the other thing is, again, look at the foods which he's allergic to, which he cannot tolerate, which causes bloat. That's important. To diagnose SIBO, one has to undergo a breath test. That is very important.
We have a question from Dayan Birwadkar, who says, during this lockdown period, I can see my paunch increasing, though I'm not overweight. I do exercises for 15 minutes a day. Can you inform me the correct diet exercise plan that can control my paunch?
Okay, welcome to the club. Welcome to the Apple Core Obesity Club. That's all I can say. It's a very common thing. I don't think you need to get worried or worked out about it. I think you just restrict your calories, do some adequate exercises, do some crunches, and that should be fine. It would go away. Classically, as I said, do more than 10,000 steps, bring down your calories, get a good exercise regime, and this midriff paunch would definitely go. Take care of your diet. That is most important. Reduce your fatty foods, your chips, what we were discussing, chips, burgers, pizzas, late night snacking, all these should go. That is very important. And slowly you say bye to your paunch.
And how good or bad are chocolates, doctor? Is this, I remember when I was a kid at the yoga institute, the head over there said, chocolate खाओगे तो एकदम stomach में कीचड़ हो जाएगी. So is that what it is? Is there a lot of muck that gathers in your stomach?
No. See, chocolates is two things. Cocoa is a refluxer and the sweetener produces a lot of weight. So both the things you're going to get hit by. And everybody has a typical thing of having little sweet after the dinner. And people have a lot of mint sweets after dinner. Now that is bad. All right, that is definitely bad because you're going to cause reflux and you're going to worsen your diabetes, or if you're pre-diabetic, you'll become diabetic, and the cocoa is going to cause you reflux. The mint is again going to cause you reflux. So chocolates per se, not very good. I would not recommend them. But yes, just to satiate your mind, you can have a chocolate, once or twice a week, which should be fine, which is not bad. But don't overdo it. That's my advice.
And what about sugar-free sweets and sugar-free chocolates, etc., that are available?
Sugar-free sweets and chocolates are good. They can be good. But again, understand, then the cocoa component comes in, which is a refluxer. So whatever you have to have it moderation. I'm not saying no to that, but in moderation.
Poonam Gihani asks another question, which is again important: how to naturally cure stomach colitis and pain caused due to through diet, and is homeopathy helpful?
So important thing is again, as I told you, get rid of all the evils. That's all. So completely change everything. Okay, and then you would know. Stop your fatty foods. Stop your cheese, your chocolates, your smoking, your alcohol. All this, get a proper lifestyle and automatically everything will change. Now, is it practical? It's not going to be practical. So you have to do it in moderation. Moderation means, what I mean is, once a week is fair enough to binge on such evils, but otherwise you should have a fair diet in doing getting on with your food. That is very important.
I want to ask you a couple of questions now. With the COVID scare that is there, are there any telltale signs in the stomach that people should be aware of?
Yeah, so COVID, basically, I think everybody knows. What is COVID? It is coronavirus 2019. That's why it's called COVID-19. That's the first thing. Please understand that. Now it comes with fever. Fever can be 99, 100, 102, and it's a high rising fever with a cough, continuous cough. It can be dry, hacking cough, or sometimes even productive. You can have a sore throat, very important. So once you get this, immediately you have to, start taking all the preventive measures, which I'm sure everybody is doing. Thing which I want to tell on this platform is, first, I'm sure everybody is wearing a mask. Please wear a mask. Keep a pulse oximeter at home. It's very important, because if you check your pulse ox, especially because we're talking to the elderly with comorbidities, keep a pulse oximeter at home. It's a very important tool. And if it shows your reading that your saturation was 98, 99, now it's dropped to 96 and coming down to 93, that is a time when you need to actually start getting help. That's the time when you can, go even to the hospital and look for help, because you could be developing respiratory problems.
What is the average reading that you recommend that should be there on the oximeter?
It should be 99, 100 or 98 to 100. That is the normal reading. If it starts touching 93 and 90, those are the alarm bells. Please start contacting people, or just get expert opinion from the hospital. That is very important. And obviously you have to get yourself tested for the COVID test.
All right.
Now the GI, what is saying is they can present as loose motions, or they can develop jaundice. But that jaundice is again when you're at the heightened of a COVID infection. And we generally we see that in the ICU. We don't just see it like this. That's it.
Great. Thank you, Dr. Shah, for a very enlightening session. Obviously, there are quite a few questions that are there related to the stomach and, the issues which are there. There were quite a few questions with specific, specific problems that are there, and we would recommend, request people to get in touch with you directly. We will, put up your email address. Sure. That they can reach you at. Thank you very much once again for being part of Health Live at Seniors Today, and write for us again, Doctor.
Sure, I will. Thank you, Pradyuman. It was a pleasure talking to you and answering everybody. It was a pleasure. Thank you so much. Thank you
very much.
Bye-bye. Have a nice day. Bye-bye.